Hello, everybody, and welcome to the next session at today's event. My name is Paul Crayford, a client partner at Aera Technology, and I'm excited to be joined today by Jon Sim, a Director of Digital Innovation in Manufacturing and Supply Chain at GSK. Welcome, Jon.
Thanks, Paul, for having me.
Yeah, shall we kick off with a little introduction about yourself and your role at GSK?
Yeah, sure. So thanks for the quick introduction. I'm looking at both supply chains, how we do innovation across both the pharmaceutical supply chain that consists of many products and brands in that space, a mixture of both brand new cutting edge ones, like some of our biopharma drugs, and then some of our legacy assets, such as like the lip inhaler that people will know, it's quite common. Fairly recently, we looked at how do we bring the two supply chains together, so both pharmaceuticals and vaccines. So the scope has obviously increased tremendously from an innovation point of view. Look at that globally. Look at how do you really improve our processes? How do you use cutting edge new technology to then drive momentum in both spaces?
Sounds like an exciting and challenging job, both at the same time. So yeah, looking forward to discussing and learning more about that role on today's call. So what made you turn to decision intelligence then? What was the trigger to start your DI journey?
So back a few years ago, just as what I do typically, I was looking into the market for a brand new cutting edge platforms specifically, with the target of building a control tower internally in GSK. We had a huge amount of performance challenges across the board where we thought that analytics in particular could really change the game in GSK, I would say. So looked into the market, we looked at quite a few solutions. We happened to come across Aera, to be quite frank. The first day I saw it, I thought, wow, this has got huge potential within GSK because one, we'd not done a lot in the prescriptive analytics space. We did a lot in the kind of basic descriptive layer across the board with Power BI, etc. So I saw it. The first two thoughts I had specifically was, yeah, great, we can leverage the advanced analytics in Aera, but also the crawlers, having the crawlers for reading from our underlying data systems and systems of record, etc., and then also pushing back in to that system is a complete game changer. And that was what caught my attention. And obviously, since that, we've went from strength to strength, from doing our first POC, which was in the logistics space for change in mode of transport and container utilization. Again, that was a great use case to get the business on board and really test it out, because we're not obviously tested the platform out. We implemented that POC, and then since that, we went from strength to strength, whether it be some of our planning skills that we've developed. They are quite huge. They're like a planning system in their own right. And then from that, we went on to some more cutting edge end-to-end use cases since that. So the journey has been pretty amazing so far.
Yeah, no, having worked with you on that journey as well, it's been exciting to be part of it. Could you share with our audience really what the importance of this initiative is for GSK?
So I think there's many ways of looking at it. The importance is fairly recently we've kicked off a supply chain transformation program, and that looks end to end of how we work back from 2030 to today, and obviously using cutting edge technology platforms, complete process redesign, business redesign to a certain extent as well. I think Aera has got a huge part to play in that. From that advanced analytics point of view, the crawlers that we've already spoke about in this call, and then obviously leveraging end-to-end skills across the board, and then more importantly, how do you connect those skills up? Because traditionally in the past in GSK, and also from my background in other companies, I think people takes a very narrow view of like one specific area of the business, whether it be planning or then logistics or then other bits, but they don't join the dots between those functions. And having the opportunity to build these skills individually for a start, really drive momentum in that space, but then take a step back with both the business teams and join it is quite significant. It's something that we've not really done before. So I think over the next few years in particular, I think the evolution of our performance management landscape in GSK for supply chain performance in particular, I think this has got a huge space. But I'll also rein myself back again. So in some of our other bigger initiatives in GSK, we've got something called smart manufacturing. Again, looking end to end across supply chain, CMC MPI, which is our link into the R&D pipeline, quality, and manufacturing in its own right. I think Aera has got a huge part to play in that space as well, from a kind of cognitive engine, looking at how do we automate our decisions across the board, or in some cases semi-automate. So I think that's a long way of saying that it's got a big part to play across the board.
Yeah, absolutely. I think you've explained to me in the past about how just the complexity of the supply chain with those new products coming on stream is just, it's forecast to get even more complex over time. And ultimately, there's going to be more decisions across that end-to-end supply chain as you described than there's going to be people and time in the day to be able to make them.
100%.
But John, what's next on your journey on DI? Where do you see this going next?
So I think we've got some really big use cases to finish off. Yeah, that's already kicked off. So one of those use cases in supply chain transformation is called smart parameterization. That's looking, it's really ambitious, just to note that it's looking at what is the key parameters across our supply chain that then affects supply chain performance end to end, both vaccines and pharmaceuticals. So we're looking quite an expansive scope. And we've identified 14 key parameters that obviously, if you look at those, each one of those parameters in its own right is quite complex, like safety stock, like lead time, cycle stock, etc. But then when you actually build up the picture of the trade-offs between each one of those parameters, I think that's got to be a huge opportunity for GSK. We're at the POV stage, so we've had very solid momentum there. So that's finishing that. I think some of our existing skills going with additional features in it, like the planning cockpit. That's a huge opportunity, and the expansion from that was done in the pharmaceutical part of the business. Vaccines is now very interested to leverage that for their side of the business. But again, I think we've only scraped the surface in GSK. I think when you look across the board, there's a huge opportunity to do other skills in the supply chain that we'll obviously walk through between Aera and GSK to populate that pipeline. But then, as I said, in smart manufacturing, start engaging with the manufacturing functions, the quality functions, etc., who are very interested in decision intelligence. I think logically that's the right next step for GSK.
Yeah, thank you. I think that smart parameters project that you're working on is very exciting. To think that changing the frequency as well at these parameters are updated, so they become less of an annual change and more of a monthly or quarterly change has a massive improvement opportunity for GSK. So to wrap up our little session here, what specific advice do you have for others who might be embarking on a similar journey to GSK?
Got a lot of advice. So where do we start with that? So I think adoption and change management is two of the critical things that needs to be properly defined in a program within any company that's looking to embark on this similar journey to what we have. So I think if you look at change management in its own right, I think when you look at the opportunity from a tech side, it's quite significant, right? Because we're moving the business on, we're changing processes, etc. But on the business side, they might have contrary views, because obviously you're moving from a landscape of descriptive analytics where people uses that alongside their day-to-day job to a more advanced layer. And whether that be using Aera or other technologies that we're using in our tech stack, the same thing applies, that people will have fear of losing their jobs. on the flip side of that, they will have the opportunity to really kind of double down, improve their own skill set, leverage the platform to take out some of that workload that they'll be using for mundane tasks every single day. So that's a huge opportunity in itself. But from a change management point of view, it needs to be very clearly defined each stage of the process and what people should expect. I think that's 100% is the one thing that we've done very well, to be quite frank, across the board, and the skills that we've taken through the innovation life cycle. I think the second thing is adoption. So again, having very clear metrics at the start and end of each phase of a skill is super important, because people need to understand and have as less of grey areas as possible of how you can get to a successful phase for each skill. So I think those are the two bits of advice. But then leaving on a positive note, it's a great platform. It's as cutting edge as it comes within the supply chain arena. It really will enable any company to drive forward, unlock a huge amount of value in the company. And I think that's what I would say. That's how I'd summarize it.
Yeah, no, thank you very much for those kind words. It's been a really interesting journey that you've been on. I'm very excited to be part of that. And thank you very much for giving up some of your valuable time this morning to share some of your thoughts with our audience. Thank
Yeah,
you very
sure.
much, Jon.
Thank you for having me.